Hello my cosmetic friends out there. We're going to do another video today on a common problem I see with Botoxing the frown, and that's looking like Dr. Spock. How do you have Botox without looking like Dr. Spock? It's a common thing I see out there in the community, and I must admit I am guilty also of giving the Dr. Spock look to a few of my patients, so I've learnt the hard way how not to do it. But certainly I see a lot of people who come to see me and they've been Botoxed elsewhere and their brows arch up heavily on the outside, giving a very unnatural appearance. We'll go through how we can prevent this for you as a patient so that you don't look unnatural and you don't look Botoxed, because this look here is probably the biggest giveaway that you've had Botox. And what is the hallmark of a bad cosmetic treatment? It is when people can tell that you've had it done. Anything that gives away the fact that you have had a cosmetic treatment, other than you look really refreshed and well and attractive, anything other than that, and basically you've gone down the wrong path. Firstly, we'll go through the anatomy of the muscles in the frown and forehead area. So firstly, the frown. Our frown consists of two main muscles: the corrugator muscle, which pulls in this way, gives you the legs 11, or the vertical frown lines. Then there is the procerus muscle, which attaches here and goes towards the nose and pulls in this way and gives you a horizontal line across the nose. And together, when you frown, you get a scrunching of that area in towards the center. So you get vertical lines from the corrugator muscle and a horizontal line from the procerus muscle. So often we inject about 5 points in this muscle to help to relax the muscle, and that relaxes both those muscles, the procerus muscle from injecting the center, and then the corrugator muscles from injecting just either side of the procerus muscle. The other muscle we deal with in this area is the frontalis muscle. So this muscle starts at the brows and ends in the scalp and allows our forehead to move up and our brows to move up. So this is an elevator of the eyebrows, the only elevator of the eyebrows that we have. Often this muscle is relaxed to stop the formation of wrinkles in the forehead. Also, we have an antagonist to this muscle up here, which is a muscle here just above the eyes, and you can see this muscle here pushes down that way and pushes my eyebrows downwards. This muscle here is called the Orbicularis oculi muscle. So that is the antagonist to the frontalis muscle, which elevates. So these are opposing teams of tug of war. So it seems simple, right? But why are there so many issues with this area? Why is it that I constantly see people who come in with the Dr. Spock look? I think one of the underlying reasons is the way that most Botox practitioners are taught from day one. I recall myself learning this back over 12 years ago now. The very first thing they teach you is a mistake. They actually teach you the wrong thing from the beginning, and I still see it. The same teaching is going on today in some workshop somewhere where some new injector is learning about Botox for the first time, and they're teaching them wrong from the outset. This is the rule they teach you. When injecting the frontalis muscle, inject everywhere you like except a centimeter over the outer brows. Don't inject that area. So basically people inject the whole frontalis muscle, and what happens is this little bit of muscle remains active, whereas the rest, you get some relaxation of the muscles, and this whole section is not moving except for this little bit just above the brow. Now, of course, what's going to happen, you can guess, is that it will elevate the lateral ends of the brow like this. So if you Botox the whole forehead and not that little bit above the brow, on the lateral parts of the brow, you're going to get compensation of that part of the muscle, and it's going to become stronger to actually elevate the lateral brow even more. That is probably one of the primary errors when it comes to injecting Botox, which is injecting and leaving that area out. And the reason they say not to do this is because there is fear that if that area is injected, possibly the brow will drop. Because remember, the frontalis muscle is the only muscle which elevates the forehead. So the fear is if you inject just above there in the frontalis muscle, that's going to cause a drop of the brow, and the patient will complain of heavy eyelids and heavy brows. But you know what? That's not the case. It's not true at all. What determines whether you get a brow drop or not will primarily be due to pre-existing anatomy or pre-existing genetics, where someone has a heavy brow and heavy eyelids, so they're more predisposed to it, or the total dose of the Botox used. That is a bigger determinant than anything else in terms of whether someone will feel heavy or look heavy after they've had Botox to the forehead. So that area, when avoided, will give the patient a false impression of eyebrow elevation. It actually just makes them look really weird. The key here, the first thing to do is to avoid injecting just the central parts of the forehead, because what will happen is the lateral parts will compensate and kick up. Now, the other thing that often happens is when the frown is injected. You see, the frown is just a strip of muscle, the corrugated muscle is a strip of muscle just above the eyebrow. When the frown is injected too high, that is, instead of injecting in the frown, the practitioner injects just above the frown or a little bit too high, and what happens is, instead of going in the frown muscle, the Botox goes into the frontalis muscle, so it diffuses upwards into the frontalis muscle. So what happens is that the muscle is kept still, the frontalis muscle is held still in the center, and then, of course, the lateral part of the muscle compensates by shooting up. Here's a little test you can do yourself to see if you are likely to get this Dr. Spock effect. And you can do it with 3 fingers. You might want to test this before you go have Botox with your doctor. And the way you do this is you just hold the central part of your forehead down and raise your eyebrows. And see if you get this elevation like this. You see? So if I Botoxed my frown and the middle part of my frontalis muscle, I would get Dr. Spock. When I do that normally, it's fine. So in my case, if I was to have Botox, I would need to have it right across the forehead and not just in the central part. So that would be the litmus test, I guess, to see whether you are a likely candidate for getting the Dr. Spock if you only Botox the central part of your forehead and not the outer brow. Here's our first patient, it's Amelia. You might have seen her before in other videos. She's one of our staff members here, so we pull her into all the videos. Okay, so let's have a look at her muscles. Give us a frown. You see the corrugated muscle goes from here to here and from here to here, and that pulls in her frown and gives her vertical lines. All right, relax. And frown again. This is the procerus muscle, goes from here to here, pulls in this way, and provides that horizontal line. If you've got very good skin and you see at rest there are no lines, some patients may have lines even at rest.
Okay.
We're going to look now at her forehead. To treat her forehead, it's quite tall. So
it's quite tall. It's quite a high forehead.
It's quite a high forehead. I actually like it, personally. She doesn't like it. The forehead muscle, or the frontalis muscle, attaches here and attaches into the scalp and in the brows. So basically, raise your eyebrows. It causes elevation of the eyebrows and eyelids. So, in order to assess how much you can put in there, you have to just make sure the patient doesn't have heavy brows. Now, Amelia is fairly young. She's got good skin there, no loss of elasticity. So if she had heavy brows like this, or heavy eyelids, we'd reconsider how much we put in her forehead. Basically what I was talking about before is the often practitioners are taught in their first day of injecting never to inject around here, because this is what they're told, this will cause brow droop. This won't cause brow droop, basically. Injecting there is an absolute necessity. So when I'm injecting Botox into the forehead, I always inject this bit above the brow, always. Otherwise, this muscle becomes hyperactive. You inject everywhere else, and this muscle overcompensates and becomes hyperactive, and then you get this unusual elevation of the eyebrow. If, for example, Amelia was injected in these dots up here, and these areas were left, what would happen is these muscles would overcompensate and elevate the brow, and these muscles here would cause the brow to drop. So you get descent of the brow medially and lateral elevation, which looks a bit like a cartoon character to me.
Yeah,
and ironically as well, as we get older, our brows tend to get higher and higher and higher. So if you look at some older people, sometimes their brows are, almost halfway up their forehead, because they're trying to compensate for excessive eyelid skin here, which their brain then tells them to elevate their brows to actually get their eyelids out of the way. So what happens is their eyebrows get stuck up there. So in fact, if you elevate the brow, you're actually emulating an older person. So you actually don't want to do that. So the other concern often is that when people get Botox here, frown for me, we knock out this muscle here. This is where the injections are supposed to go, around here. But sometimes people, practitioners may inject, instead of injecting there, they inject up here. So what happens, instead of hitting this muscle here, which is the muscle that you want to inject, they end up hitting again the frontalis muscle, which elevates the eyebrows up. So if this injection diffuses into this muscle here, it will press down on that part there, which again will make the brow compensate by pulling up there. So you've got to be very careful with where you inject your corrugator, not too high. And then the final mistake, just to top it all off, to make the icing put the icing on the cake, is put Botox in this spot around here to actually reduce the downwards pull of that muscle. So that muscle normally pull down, and you knock it out with Botox here. But when you do that, you get even more elevation of the brow. So what happens is that people leave this area here unbotox. They Botox this area. So in other words, basically the tug of war goes in this direction. So this muscle is left to be strong. This muscle is made to be weak. And where does the brow go? It goes up on the lateral part. So again, a very unusual appearance. Those marks look really unusual too. Let's actually do it properly for you.
Okay.
So now we're going to inject her face properly with Botox and show you how it's going to be done. So I'm just going to clean all these marks off for you. I remember a time actually when I injected a man, a very sort of successful CEO of a company, and he actually I actually made the classic mistake of injecting him in the middle of his forehead and not so much on the outer parts of his forehead, as well as injecting the frown and giving him a brow lift. And he looked so weird that he couldn't go see his own mum, because when he went to see his mum, he had to focus on actually not elevating his eyebrows.
No.
So otherwise he just looked like, it's worse on a man than it is a woman. So brow lift doesn't look good, arching doesn't look good on a woman, but it looks even worse on a man. So
It's so funny.
yeah, so basically that was, I learnt my lesson after that. It was a long time ago.
Yeah.
We'll just go through our usual treatment regime with Botox, and first thing is just to mark out all the veins. So I'll do this. So marking out all the veins reduces the amount of bruising you get. So for people wondering, this is an Accuvein machine. This is the Accuvein vein finder. It actually detects the veins and shoots out a laser image of where they are on the skin, so you can mark them out. The veins are marked in red, and we'll mark where we're going to do Botox in black. I always mark because I think when you mark the patient, you visualize what you're going to do, and there's no guessing when you're doing it. There's no umming and ahhing. You've already pictured what you want to do, and you go ahead and do it. So before I start, I mark frown, quite a strongish frown, even though
Even though what?
you only had Botox recently, but it's still working. Yeah.
No, nearly 3 months ago.
3 months, okay. Raise your eyebrows. Very strong in the central part of your.
I know.
In the central part of your forehead, you have a lot of strength there.
I'm a strong woman.
You're a strong woman. Raise your eyebrows again. Now we have to make sure that we have to hit these areas above the brow. Now it seems like there's a lot of injections going on there, but the muscle is fairly large muscle. Okay, your hair's alright.
It's fine.
The hair's done. That's good. The strong muscle, and the muscle is actually quite a wide muscle because that's the nature of the frontalis muscle. So the best way to get the best results from Botox in the forehead muscle is to actually do lots of little injections. And that's what we've done. And that's what we've done here. Notice also that the frown muscle has not been done too high. So we're not going to infiltrate the frontalis muscle from doing the frown corrugator muscle. They're nice and low, exactly where they should be. Not up here, but in here. Right along the muscle. Frown again for me. So that's right in the muscle belly. Because we are injecting above the eyebrow here, we can inject a little bit here as well as insurance. Injecting under the brow, that's our insurance policy because it helps protect against the effects of the Botox in the forehead muscle, which tend to push down. This will neutralize that effect. However, if I don't Botox this area here, if I don't put Botox in there, I'm going to get a lot of elevation there, and that's going to look weird. So definitely Botox that area there. Here's our Botox. To help with pain, we're going to use a bit of ice and a bit of vibration, okay? A bit of ice and vibration. Now, too much ice is not good either. That gives your brain freeze. With care not to go in any of the veins. How's that feeling?
It's good.
Yeah, not too bad.
Not too bad.
I'm getting a lot of injections.
I know.
Now, we decided not to make you into Mr Spock today.
Thank you, Gavin.
That's right, yeah. That's funny, like most patients will ask you for an arched brow, but I think what the key is you have to talk them out of it, because that's just a poor outcome. I think it gives you away. So it's very important to do so, because without the right expectations, you're never going to get a happy patient. Okay, all right, that's done. So that was the forehead. Now we'll do the frown muscles. So first we'll inject the procerus muscle, which pulls the brow down. It gives you a horizontal crease on the nose. And now the corrugator muscle, which pulls the frown together and gives you vertical lines. So remember, static lines are different to dynamic lines. So static lines are lines which are there at rest, regardless of whether you're frowning or not, or expressing or not. And dynamic lines are there only when you move or express. So we are done. So we'll see how that treatment goes, and we'll see if she gets a Dr. Spock look when she comes back in for a checkup. It's been 2 weeks since we've treated Amelia, and we've got it back here for a review so you can see the results and see whether we gave her a Dr. Spock or not. How'd you go, Amelia, with your treatment?
Very well. I'm very happy.
That's good, great. You look very nice. Let's have a look at your frown. There's a little bit of frown remaining there, so we may need to top that up a little bit for her. And raise your eyebrows for me. Okay, now notice the left eyebrow does raise a little bit more than the right. Do that again. And that could be due to a number of factors. It could be due to having more strength on the left side naturally. It could be due to the depth of injection, which is hard to monitor sometimes. But we know that the dose and the placement exactly, and I was quite happy with the dose and placement, but nonetheless you can still have a difference in effect on both sides. Now this is why it's important to get people back to have a look and check on their result to see if they do need a top-up. We do top-ups for patients if required, and usually we don't charge patients for that. Imagine if we didn't inject over this part here. If we didn't inject over the lateral eyebrows, raise your eyebrows again. Now already there's a little bit of lateral brow elevation, even despite the fact we injected over those areas. Raise your eyebrows again. There's also a bit of wrinkle up there we need to get rid of as well. But imagine if we didn't inject her lateral eyebrows. She would be looking very, very unusual right now. And it goes to show, even though she was stronger centrally in her forehead, her lateral forehead muscles are strong enough to cause an elevation. We're going to do a little top-up on Amelia's forehead and frown. Generally, we don't need to leave any movement with the frown. It's a muscle which is a negative expression, causes a negative expression, so we just take it out. Yeah. Raise your eyebrows. So there, relax, up again. There, raise up. There too. Okay. All right. So we're going to top up these areas with a bit raise up again. Bit of extra
frozenness.
Extra frozenness. It's interesting, despite the fact that we've put a fair amount in, she's still got some movement and it looks fairly natural.
Why would that be? I don't know why.
Yeah. It's all done. All done.
All done. Bye.
So in conclusion, it is important to do Botox in such a way that you look natural, that you don't look arched or Dr. Spocked, and you can see here that it is not hard to accidentally do that. And it's all about balancing up the actions of the muscles and not being fearful of injecting over the brow and being fearful of causing brow droop. So if you want to see more of this sort of content, please don't forget to like and subscribe to our videos, and we'll try and bring you more of the stuff that you want to see on our channel.